Hi guys, welcome back to my YouTube channel. I'm Dr. Fatma Salim. Today I would like us to discuss different types of heartburns. Apparently, people have been mistaking the serious types of heartburn with the normal ones, and they end up dropping dead because other types of pain that mimic a heartburn are usually very serious and they require an urgent intervention. However, not so many people know about this, so I decided to analyze with you guys to discuss in length about these types of heartburn so that you guys will be well informed and know for sure when you feel this type of heartburn which one requires an urgent intervention and which one you can simply take antacids and you'll be fine. Guys, before we continue, kindly subscribe if you have not done so. I very much appreciate. So guys, there are different reasons or diseases causing a heartburn. I will specifically be talking on 5 of them, or conditions. I'll mix diseases and conditions that leads to a heartburn. My first disease is on gastroesophageal reflux disease. It's a disease that is commonly known to cause a heartburn. There's also esophageal adenocarcinoma, that is cancer of the esophageal, that as well causes a heartburn, and a heart attack or heart diseases. Some of the heart diseases are also known to mimic a heartburn. And my fourth will be on gallbladder disease or gallbladder attack, that's also known to mimic heartburn or cause a heartburn. And my fifth will be on a heartburn experienced by pregnant women. So on this video I will mainly talk about gastroesophageal reflux disease and a heartburn experienced by pregnant women. For esophageal adenocarcinoma and heartburn experienced during a heart attack or gallbladder disease, these are topics that needs to be covered on their own so that one can understand clearly the symptoms and be able to differentiate. So please tune in for my next upload so that you be informed on the different types of diseases or conditions that cause a heartburn. Well, so we shall start on GERD. GERD is gastroesophageal reflux disease. Usually, esophagus is the pipe that links the mouth or the throat with the tummy. So once you swallow the food, it goes through the pipe to the tummy. So this pipe is the one that is called esophagus. This pipe, usually at the distal end of it, there is a sphincter known as esophageal sphincter. The function of this sphincter is usually to open and let the food get into the tummy and close so that the food does not go back to the esophagus. This is the esophageal sphincter, as you can see at the distal level there. Now, when someone eats some food, the food is supposed to go through the pipe, so it passes through the pipe. When it reaches the esophageal sphincter, it opens and the food passes to the tummy. But there are people who have some defect, or the sphincter is sort of weak and does not close properly for one reason or the other. There's a condition that limits the sphincter from closing properly. That being said, so once the food has passed, as we know, the tummy is usually the tummy is usually acidic because of the H. pylori that usually produce acid to help with the digestion, breakdown of food and all that. And because of that, so when the food goes in, it mixes with the acid, and the food is broken down into small particles. So if the esophageal sphincter does not close properly, this food in form of liquid, it goes back, it goes back to the esophagus through the sphincter, and it creates an bearable sensation, the heartburn, so to say. Makes one experience the heartburn. You feel like your throat is somewhat, and there's discomfort on your throat, or some burning sensation. At times one feels as if there's some food stuck on the throat and it's not getting cleared and all that. So this is the sensation that is caused by gastroesophageal reflux disease, meaning that the fluid or food content in form of fluid, they go back to the esophagus through the sphincter. The sphincter is defected and it cannot close properly to limit the food or the fluid from flowing back to the esophagus. So this is a condition experienced by people who have a defect of the sphincter. A heartburn can also be experienced with someone having peptic ulcer disease and all that. I've discussed in length about peptic ulcer disease. So if you are not quite familiar with peptic ulcer disease, please visit my previous video for that. We'll only limit this video for the purpose of GERD and the pregnancy, the heartburn experienced by pregnancy women. So that's for this case, usually there are no other symptoms being experienced unless one has a combination of peptic ulcer disease plus GERD. Then someone will be having abdominal pains or epigastric pains. Someone will be having nausea, vomiting, and other symptoms of peptic ulcer disease. Or as for pregnancy, it's individual. There are those that experience a heartburn during the first trimester and those during the second and the third. So for those at first, it's usually due to hormonal changes, but those that experience towards the second trimester, end of second trimester and third trimester, it's usually because of the baby occupying the abdomen. Thus, he pushes or she pushes the stomach upwards and the esophagus. So through that, someone ends up experiencing a heartburn.